base for political action, which is in academy people used to call research action. And after that, in 2009, 2010, we developed an advocacy work based on the research we have done in the 2007, 2008, and you pick up the gaps that you think that were more important to create your own advocacy work. And I think that it was really interesting because it was everything that you were saying now, you were saying because you have data that allow you to say that's the problem and we need to solve it because that and that is happening. It is very important. Just to remind us why we developed this project. So the first thing is that we realized that it was very important to improve the participation of AIDS groups following the UNGASS-AIDS Declaration of Commitment, bring it to the table the discussion of sexual and reproductive health and rights. I remember a conversation that I had with Zuni here in 2005 at the International Women Health Coalition that we were commenting in 2005 that where are the information about women in the UNGASS reports? So we didn't have that at that time. And that's why we decided to put this project together. We are not only talking about HIV and AIDS, right? So we are talking about human rights approach, we are talking about gender perspective. Part of the problem that we don't have integration between sexual reproductive health and AIDS policies is that because women are not participating in the process for making decisions about the AIDS policies. So we need to improve that participation. And basically, it's the general idea is that you need to have local, national, international advocacy at all levels in order to have this piece of the word fixed, if you can say that. The most interesting part of this project to me is to see how, when we were able to use the International Declaration of Commitment as an advocacy tool, creating awareness about it, things start changing.
Firstly, I would like to say I'm glad to be part of the UNGASS-Forum, and I'm also happy to hear that the UNGASS-Forum is really focusing on health issues, also focusing on advocacy. Because this is a main problem actually in South Africa. In the organization, we've tried to do some training around the law for something, yes, for sexual voice to be heard and write stories, and I think it's good, but I didn't take it in a serious way, but now it's in my mind that it is important because we do communicate with some in other countries.
In Uruguay this year, the government starts, it's supposed, to linkage sexual and reproductive health with HIV, but not in our sense. HIV is becoming invisible, is putting less money for HIV, and it's like not a really comprehensive approach of how to link HIV with the another dimension of the sexual and reproductive needs of the people and of the women especially.
What we met, what the challenge we had is that there is no evidence base for us, I mean for countries with concentrated epidemic about HIV and sexual and reproductive health in women. Because our country didn't report and don't report for sexual and reproductive indicators, you see. And what we do by our forums, we try to highlight these questions about sexual and reproductive health and to try to include and to start to discuss here with our government and no evidence based because everybody talk about concentrated epidemic and about IDUs but not about women and HIV/AIDS. Yeah.
For the second phase, there is a lot of movement from the Thai MOPH also that they think that the UNGASS report is not that we just need to submit the report to UNGASS, but it's the process and we use it as a mechanism to drive the movement in at all levels. So we have UNGASS at the provincial level also. Yes, so about 20 provinces join with this one.
Our focus for 2011 is not exactly the high-level meeting per se, but the whole advocacy work that we will be implementing. And then part of this advocacy work is also creating this momentum to make sure that when we meet in 2011, we need to have a high-level meeting. Something needs to happen that people say, you know, that's okay, we have the food crisis, we have an energetic crisis, climate change and so on, but we still need funds for HIV and AIDS because it was we never met the amount of money that we need to put in place the needed response.
They don't want to support countries that could afford the activities and that they are not so poor, and in which epidemic is not is concentrated. So what they say, this is only going to be financed, the financial support for the risk groups, even they don't say risk group, but they are, you know. And sometimes the countries didn't incorporate on those risk groups, even trans people, even. But never, this is completely in all the countries, they never incorporate young people and they never incorporate women. So the problem seems to be that HIV/AIDS is only to support by donors only for the most poor and never for the women and young people. And these are the more vulnerable groups. What are we going to do? Sorry, it's a bit depressed, but that's a reality.
So part of our challenge is to go through all those issues here without getting depressed.
No,
Because
no,
we
no.
go
The reality
yeah,
we
we need to,
yeah.
to be ready to face the reality.